So today we are here with Eli. He is here for his 6-year-old well visit. He has no complaints today. I have talked to his dad, and he is just here for his 6-year-old wellness visit. Past medical history, he has no major illnesses, no hospitalizations, no surgeries, no allergies, no seasonal allergies. He doesn't take any medications regularly. His current health, he's in good health, and he has not been sick recently. Is that right, Eli? Okay, good. So we're going to do a quick review of systems. As far as general, have you been experiencing any fever? Have you been tired lately? Okay, good. What about your vision and your hearing? Have you been able to see okay? Been able to hear okay? Yes, yes, you have been. No recent ear infections. Have you been coughing recently? Any shortness of breath? No. Okay. Does your chest hurt? Any pain in here?
No.
Okay. Have you been having any belly pain?
No.
Any diarrhea?
No.
Any vomiting? Any nausea? Like you feel like you're gonna vomit? Okay. Any troubles urinating, like peeing when you go to the bathroom?
Me in bed.
No, it's okay. Just say no. Okay. Any rashes or anything on your skin? Nope. Any headache or weakness recently? No. All right. And after reviewing his family history with his dad, there is no family history of asthma, diabetes, heart failure, hypertension, heart disease, anything like that. He lives at home with his mom and his dad and his younger sister. There is one small dog. There's no exposure to smoke or secondhand smoke in the house. Developmental. So how are you doing in school?
Good.
He does pretty well. I verified with Dad. He can follow simple rules. He shares and plays well with others. And he has lots of friends, right? Right? You play with a lot of friends in the playground?
I have four. I have two. I have two at home, four. You have two at home.
Yeah. And he can count his numbers, he can write, and he's pretty good at reading. So I would say he demonstrates all of the developmental milestones appropriately. So now we're gonna move on to physical exam. His vital signs were stable. His blood pressure was 98/52. Heart rate is 101. Respirations are 22. His oxygen is 99% on room air, and he is afebrile today. He currently weighs 45 pounds and 47 inches. So for weight, that puts him in the 40th percentile, and height, that puts him in the 50th percentile. So he is on a normal growth pattern, as he should be. So now we'll start with the physical assessment, all right? So I'm gonna listen to your heart, okay, bud? Good deal. Lean up for me. We'll listen to your lungs. Just stay right there. Good. Take a deep breath in and out. Good. One more. Good. All right, now we're gonna pretend like this is an otoscope, and I'm gonna look in your ears, okay, bud? That ear looks good. That ear looks good. All right, now I want you to open your mouth wide for me. Stick out your tongue. Say ah. Good deal. Then look in your nose. Nose looks good. Look at your eye. Look at me. You can put your tongue back in your mouth. All right, eyes look good. All right, I want you to follow your eyes with my hand. Follow your eyes with my finger. Good job. All right. So now I'm gonna just kind of feel these lymph nodes all in here. See if I can feel any under your arm. All right, I'm gonna press on your belly. Does any of that hurt?
No.
Okay, good deal. All right, now I'm gonna listen to your bowel sounds. Make sure they're moving. Good deal. All right. We assessed his gait when he walked in. He's normal range of motion. There's no swelling or deformities anywhere on his body. His breasts, I would check if they were symmetric. I would check for any lumps or any masses. And as far as his genitalia, I would check for normal male development, his testicular, if they've dropped, any hernias or any lesions. And I think that's it. His skin is warm and dry. All right, squeeze my hands, bud. Good deal. All right, so now I would go into the anticipatory guidance phase of this visit. I would go over nutrition with Eli's dad. We make sure he's getting a balance of fruits and vegetables, whole grains, meats, not just chicken nuggets and peanut butter jelly. I would also encourage physical activity, which him and dad state that he's very active in baseball and he plays at recess and they visit the park frequently, so there's no concerns there. I would also encourage safe sleep routines, sleeping at least 8 hours a night. And then I would also encourage daily reading, daily writing to keep that school performance up. And then safety, Eli needs to be in a booster seat, wear a helmet when he's riding a bike, and he needs supervision when he's around the pool. Even though he can swim, we still need supervision. And at this age too, they should be having 6-month visits to the dentist. Screenings for this visit, we would do vision and hearing, which we tested, and I don't have any concerns with Eli. Developmental, all are within normal limits for this visit. Do you have any questions or concerns, bud? No. As far as immunizations, he's up to date on everything and he would not be receiving any at this visit.